Hey everyone, welcome to another episode of Darshan Talks. I'm your host, Darshan Kulkarni. I'm really excited to have our guest today. Our guest today is going to be talking about finding relief from what ails you. And that's such a general term and general statement, but I feel like it's appropriate because my guest today is a physician by training, an educator by choice. His training background includes a medical doctor degree and additional degrees in age management and regenerative medicine. He is, I believe, at current count, he may be one degree short of the number of degrees I have, or he may be over. Can't tell. We're having a degree off right now.
Right.
He is an entrepreneur, coaching doctors launch new online businesses and growing their existing ones. You can actually find him, and I'm going to share the link, drernestomd.com/Darshan. There's a special page for you if you decide to go there. He is all kinds of awesome. I actually met him on Twitter, and I was like, I have to talk to him. We landed up talking a little bit about what it takes to bring. This podcast, this live stream, is about bringing new products to market and keeping them there. If that's true, what that requires is someone going, I have an idea. It requires someone going, I don't want to be the physician, the pharmacist who either licks, stick, count, pours, or just diagnoses patients and feels like they're undervalued and underappreciated. So it felt like there was a natural conversation to be had, and I was really excited to have it. So our guest for today is Dr. Ernesto, and he calls himself Dr. E, which is funny to me because I believe E is like a psychedelic drug, but I don't really remember. But it's good to have you on, Dr. E. How are you doing?
I'm doing great. Thank you so much. And that was a good introduction. So thanks.
So let's start with the beginning. How did you decide? Like, let's actually start with the good news before you even start from the beginning.
Right.
The good news is you would you want the person telling you how to live your life to be living a happier life than the one you think you're living.
Correct.
And to that end, Dr. E is sitting currently in Spain as he has a wonderful time with his wife. So you know what? He's living the life we all aim for. And that should say something. So what we want to hear, Dr. E, is how did you come to the spot you are? How did you decide that this is the path you want to take? And why should other physicians follow that?
Right. Well, I came to this by accident almost. So I at one point, 2010, I literally just stumbled into a stem cell practice in Cancun, and we were doing a lot of medical tourism. So all of our patients were from the US and Canada and Europe, but it was failing. It was failing miserably. And I got connected with the guy who originally owned it, and I was invited, and I partnered up, and I realized that I didn't know how to run a business. Most doctors, and I'm sure you're experienced with this. As a matter of fact, if I recall correctly, that was our conversation starter on Twitter. You said something along the lines of, well, yeah, but doctors aren't good at business. And here's the thing. Nobody trains us in medical school. We all think it's just a matter of I hone my skills, I become a really good doctor, and then the business will just happen, right? The money will come because patients will recognize that. And it doesn't happen that way. And so I literally had to go out there and learn. And it was so funny. I remember my dad, and he's not a physician. He faints at the sight of blood. But he and I were talking, and I was telling him how frustrated I was of running this place. And just, it wasn't working. We had this great technology. We were making great advances. We had this great equipment and all these amazing things. And patients just weren't finding us. They just weren't coming to see us. And one of the things that my dad said, he said, you know what, you've done a lot of work in different areas. You've trained, you've done all these things, but you've never really had anyone to teach you or that you can learn from. You've never had like a mentor or a boss or a coach that would teach you and show you how to run a business. So you're really just flying by the seat of your pants. And that kind of like dawned on me that he was absolutely right. Like all these years of schooling, and I have no idea how to market a product, how to come up with the idea of a product, what an offer is, how to do any of these logical things that any business owner knows. So I sought out a mentor, and I ended up working with Darren Hardy, former editor of Success Magazine, the publisher of Success Magazine, and I was part of his mastermind groups, and I just fell in love with this, and I started helping some of my colleagues, some of my friends who started seeing the success that we had, and that worked great, and they started doing well, and then they started referring me to people I didn't know until somebody at one point said, "So, how much do you charge for this?" And I had no idea, so I just gave him a number, and he said, "Sure." And that's when I realized that I was in business, and so now I was growing a side gig, coaching and consulting other physicians, and that's how this whole thing started.
So what you're describing is serendipity. You're describing this idea that you didn't even know what you were getting into, and success found you. But that is happenstance, that is luck, and it seems to have worked out for you. But what you're trying to avoid is other people trying to just get lucky. And what you're really describing is, how do you productize luck, for lack of a better term?
Correct. Absolutely. That's actually a really good point. I got lucky that I happened to have that conversation with my dad at that point, and that I was in a position to not feel attacked. Because that's the other thing. One of the things that I've noticed with a lot of my colleagues is that when you bring this part up and you say, well, maybe you should look into, learning a little bit of marketing, or maybe go get a sales training, or maybe do a little bit of this, they get offended. 90% of the time, they're like, well, I'm not that kind of doctor. I'm not in it for the money. And what I always tell them is like, listen, do you have bills to pay? And they say, sure. Then you are in it for the money. If you cannot afford to work for free, you are in it for the money. And so that was the part where I got lucky. And that's one of the things that I try to instill in physicians, especially the younger generation, who is like, listen, guys, we need to learn these things, because if not, what's going to happen is that you're going to have to take a job that you probably are not going to really, really love. You're going to be very limited. You're going to be very constrained. They're going to be telling you how much you can make, and you're not going to have an alternative. And that's the most important part of what we teach. Because it's not just for physicians. It happens to nurses, it happens to pharmacists, it happens to pretty much any skilled professional at this point, that they end up getting a job and they're being miserable because they're treated like cogs in this whole big machinery, but they don't have any options. They're like, I got $250,000 in student debt, and I need the job. Where else am I going to get paid? And so, well, that's where you need to learn how to productize your skill set.
So let's start. I mean, you just gave me a little spiel on how you got to where you are, and I have literally about 7 questions that are already ready. But let's try to tackle each one individually. So the first thing starts off with what you just described a second ago, which was you said that you spoke to one of your friends or one of your clients, and he's like, I'm not the type of doctor who's in it for the money.
Right.
But let's be honest. We've as a society told doctors that we only want the ones who care to be doctors. Otherwise, you're in the wrong profession. You shouldn't be doing this. And to be fair, I think success comes in different forms.
Right.
And every individual will define success in a way that's meaningful to them. Some people will say it's about the money. Some people will say it's about patients being happy. Some people will say it's about having control of your life, et cetera, et cetera, et cetera.
Right.
So how do you advise a physician who has, say, he's working as a hospitalist in a hospital and is unhappy is considering it has a unique new system. Let's say it's a new drug. He's come up with a new concept for a drug. And he wants to get out of what he's doing. He wants to spend time. How do you help him or her first define success to know if this is right for them, if they need to move out of what they're doing? Or yeah, let's start from there.
Well, that's actually a great question. And that's literally the place where we start at. A lot of the times people will come to me and they're like, you know what, I've had it. The only reason I haven't quit my job is because I have bills to pay. That's it. If I didn't have those bills to pay, I would have given in my notice. I would have just stopped going a lot of the times. They're like, I hate the place. So what can I do? Because they've been looking at jobs. They've been sometimes even applying. And they have no idea what the next step is. And I always tell them this. I say, listen, let's first, before you start jumping, looking for jobs where you're just going to go from one awful place to potentially another awful place, let's figure out what you want to do with your life. What do you want to achieve? What would be success to you? What would be, if I had a magic wand that I could just wave and design your day-to-day, what do you want that to look like? And that's another thing that nobody teaches us to ask ourselves when we're in medical school. Nobody stops a young, 20-year-old who wants to go into medical school and says, like, do you have any idea what the day-to-day of a physician is? Because I know it sounds great to be the pediatric cardiovascular surgeon, but do you know what they do on a day-to-day basis, like every day? So a lot of times we don't, and that's why you have so many unhappy doctors. They get to residency, they get to their internship, and they're like, this is awful. I don't want to do this for 40 years, right? Because we never stopped and thought about this. So that's the first step. Like, what is important to you? Do you want the big paycheck? Do you want to be home at 5 p.m.? Do you want to work 4 days a week? Do you want to take vacation wherever you want? Do you want location independence? That's what got me. Because medical licenses aren't exactly portable. You cannot just pack your stuff and go to Spain unless you look for alternatives. And so that's the first thing that we do. We need to define, what does success look like to you? Not to me, not to the world, not to the TikToker, that's famous right now or wherever. Like, what is it to you? And a lot of the times it's not the $10 million a year gig. It's more like, no, I just want to see my kids grow up. I want to stop missing their baseball games. I want to spend more time with my wife. I want to be able to take Fridays off. I want to be able to do these things. So that's the most important thing. And it doesn't matter what industry you're in. We all have to define that. And the problem is that we start with a job and then we try to fit our life around it, when it should be the other way around. Like, this is what I want my life to be like. And then I build a business around it that serves that life. Because if not, you're doing it backward.
Which really raises the question. So let's say you were that MD PhD who found this new molecule that could change patient lives. Let's say you are now being asked to go take care of patients, and you know what, you went to medical school, you can take care of patients, but you're really now passionate about taking this drug to market and saving millions of patient lives. So my first question for you is, passion enough?
That's a really good question, because passion doesn't pay the bills. So it gets to a point where we actually have to come back down to earth, right? And so, like, okay, well, passion is great because that's what keeps you going. That can motivate you, but you cannot go to Wells Fargo and say, I have a lot of passion. Will that take care of my mortgage? It simply doesn't happen. So we also need to build this machine that is going to help us actually generate some revenue. So it might require you to scale down for a little bit. It might require you to look at alternatives, but it is silly to say, I'm really passionate about this, so this is all I'm going to do for the foreseeable future. If it's not paying your bills, if it's not allowing you to support your family, if it's not allowing you to provide, if you're the sole provider, or if you're going to put a lot of strain on it. So it is very important to figure those two things out. And in the specific case that you said, then it's just like, okay, let's take a step back. How much is it going to cost you if you scale down, for instance, if you scale down your lifestyle? Okay, well, this much. How much do you have in savings? How long do we think it's going to take for you to actually get that specific product to market? And let's be realistic. Can you live that long with however much you have saved? And if the answer is no, then we need to figure out a way to make money while you're doing these things. And it might mean moonlighting at a different hospital. Like, oh, well, but the job that I was looking for, they only take full-time. Okay, let's look at a different one. Let's, maybe you are a rheumatologist, but you have to take a gig as a general internal medicine physician. Okay, that's just what you're doing now to fund your passion project. But it is important to have a plan, because a lot of the times, like you just said, like, people will just jump. Like when somebody gets like really sick of their job and they just quit, and then they sit down and they're kind of happy for 15 minutes, and then they realize, like, oh crap, how am I going to pay for everything? Right? How am I going to support my kids? How am I going to do all these things? Like, well, maybe you should have thought about that before you you walked out on everyone. So that's another very important step. You have to be, I don't like the word realistic because I feel that's very limiting, but you do have to be down to earth, and you have to recognize that, hey, passion does not pay the bills. So how am I going to do that?
So it's funny. I think that so first of all, can you hear me okay? Because I seem to be having
Yeah,
a connection.
I can hear you well.
Oh, good. So my question then is, in your case, you discovered passion's not enough. You discovered success requires a definition. Who knew success requires a definition? But success requires a definition. But all that came because you had the right mentors, you had the right mentorship.
Right.
So my question for you is, how do you? One of the hardest things about being a physician, I imagine, is everyone expects you know the answers. That's why they came to you. And you have to, at some point, go, I don't know the answers. I need mentorship. You have to accept that you may know the answers for what you do, but there are a million other jobs, a million other positions, a million other roles, and you may be starting at the bottom of one of those. So that humility that comes out of that is really difficult. I know it was difficult for me as a lawyer to accept that I don't know a lot of things.
Right.
Or you may be aware, but then you have to admit it to someone else that you don't know those things. Mm-hmm. So how do you advise a physician who is, I'm making this up, but let's say they're head of the department, or they are pretty high up in their food chain, but miserable, that they need to find a mentor who can tell them how to do something different. And that person may be younger than them. That person may be in a different field than them. How do you go about finding your mentor? How do you go about finding your guide to that next stage of your life?
Well, so the hardest thing is to, like you very well described it, is to put your ego aside for a second, right? And recognize that, you know what, this is one of my limitations. This is one of my shortcomings. And you have a choice to make. Either you work on it, or you just kind of like work around it, right? And have somebody else to do these things for you. And that's how, if you want to work around it, you go like, I have no marketing skills. I have no, copywriting skills. I have no interest in learning that. Okay, perfect. Then you get to be an employee. And there's nothing wrong with that. I think that recently, this culture has put down a lot the fact that, that people like being employees, or that people go like, listen, I don't want to deal with all that crap. I want to show up. I want to see my patients, and I want to go home, and I want to not have to care about, the somebody suing the company. I don't want to care about any of those things. And I just want my paycheck. There's nothing wrong with that. You just have to recognize. And the problem is that we often want this without having to learn the stuff that we need, right? We're like, yeah, but I hate the job. We're like, okay, perfect. If you want to be a business owner, you need to learn the skills that business owners need and have. And that's, marketing and business and sales and maybe writing copy and maybe building an audience and doing all those things. That's the day-to-day of a business owner. Again, nobody tells you what the day-to-day is. You see the business owner like, oh yeah, I want to be the next Steve Jobs, or I want to be the next Elon Musk, or I have this great idea that will revolutionize healthcare. But you don't realize that their day-to-day is incredibly mundane, and they had to learn these skills. So that's number one, putting your ego aside and saying, there are stuff that I don't know, and I have to make a decision. Am I going to learn it, or am I going to go around it? And going around it might also mean I'm just going to hire a bunch of people because I have a bunch of money here, and I'm just going to hire a bunch of people, and I'm going to build a team, and I get to be the doctor, and then I'm going to build a business development team. Great idea, but you are aware of it. That's number one. And then number two is now that you know, just search that person out. Look for somebody who's doing what you want to do and talk to them. I've always found this very surprising, how a doctor will see another doctor having success, and they will criticize that successful doctor instead of going to him or to her and saying, hey, how are you doing this? Where'd you learn this? How do you come up with this idea? Why are you doing this? And you'll hear them behind their backs. They go like, oh yeah, he's a sellout. Oh yeah, it's just marketing there. Oh yeah, it's because they bought followers. Like, so what? If that's something you want to do, why don't you go learn from them? Why do you ask them? A lot of times they'll say, for instance, the way that I get most of my clients are referrals from some of my existing clients. When somebody actually does go up to them and go like, oh my God, you're doing great. What's happened? I started working with this guy. And frankly, it's not that I'm that good. It's just that most doctors are that bad when they start these things. So just a tiny little, improvements and just recognizing these little blind spots that we didn't realize we had will give us a huge boost and that's why my newsletter is called It's Not Brain Surgery, because business, it's not brain surgery, but it requires a set of skills that we don't know.
So you said an important thing in your statements a few seconds ago. You said, if you don't know something, you go find an expert and you pay. You may have money. You pay that person to be an expert. But there's a difference between finding an expert and finding a mentor. Correct. What has been the difference for you, and why does that difference matter?
Well, because when you find a mentor, you actually become a new person, and that's another very, very important thing, right? You cannot do something. The person that you are today cannot achieve those results that you're dreaming about until you become this other person that gets these results. Because if the person that you are today could get these results, you would have already gotten them. And that's just the way it is. And people don't like to recognize it. They're like, well, no, but I like doing this. I'm just going to do more of it. Like, no, that's not going to work. You need to think differently. That's why I always tell people, like, realistic goals are a waste of time. You need unrealistic goals, because when you think of realistic goals, you say, oh, I made 100,000 this year. I want to do 110,000 next year. So then you think that I just need to work 10% harder. I just need to put in 10% more hours. But if I tell you, you made 100K this year, how are you going to make 1 million next year? Automatically your mind goes like, well, I cannot work, 10 times as much. So I need to figure out a different way. And that's exactly what a mentor does. A mentor will challenge you to actually become that new person. Will challenge you to say, hey, you know what? There's other ways of doing those things. Have you ever thought about this? Have you ever thought about this? Have you ever thought about this? And that's what's really, really important. And I have mentors in two kinds of mentors. I have mentors that help me in business and that are not in my same industry. And that's what a mastermind was great. And that's why, what got me a lot of progress with Darren Hardy and things like that. But then I also have mentors who are in my industry, in health and healthcare. And those are also incredibly valuable, because the mistake that we often make when we start looking at people outside of our industry, like, well, that will never work here. Yeah, that's great, but it will never work in law. That's great, but we have regulatory affairs. That's great, but and so when you have somebody who's done stuff that you want to do in your industry, now you no longer have that excuse, because they're like, no, we just did this. We just did this other thing. Oh no, have you thought about doing it this way? So that's why it's also important. And you don't have to marry. A mentor is not somebody that you marry. It's somebody that helps you get to the next level. And then you can go to, get somebody else and or continue working with that person, but get another one. You're literally just learning. It's like thinking that you had one professor all throughout college. Like, no, you learn something from different people.
So you mentioned mastermind a few times.
Yes.
Could you tell people what a mastermind group is? And is that the place to find mentors, or are there other places?
So a mastermind is essentially just a group of people who get together and help each other solve their problems with different perspectives. You know how they say that a lot of the times you're too close to your problem to really see it. And then so you need to step back. And what happens is that when you step back, you usually go and consult with your team. But the problem is that they're just in it as deep as you are. So you're just seeing the exact same blinds, but you're just seeing the exact same things that didn't work before. We're not going to try that. So when you go, a mastermind essentially is a place, and these are incredibly valuable. A lot of them are expensive. So some of the masterminds that I've been part of are, $25K a year, $30K a year. But a lot of them, you can just get together with friends, with people that are going to challenge you. And the important thing is that everybody's there to help each other out. So let's say you and I and another 3 people have a mastermind. And so we get together every Tuesday and we sit down and we say, hey, Darshan, so what's going on in your business? What current challenges are you having? So you share some of those with us. You share some of your wins as well. You share some of your challenges, and then we all help you brainstorm and say like, oh, we had something similar. Have you tried this? Somebody else will say, we've done something similar. Have you tried this other thing? Or, we're talking about these things, and you introduce people and do all sorts of things. Not so much, well, at least not in my experience, have I found mentors in my mastermind groups, but I have found new mastermind groups from my mentors. So the mentors that I work with, they all often say like, oh, you know what? I've been part of a mastermind group that I want you to, that I think you'd benefit. Some of them actually, so Darren Hardy has his own, private, intimate mastermind group. But I guess you could also find your mentors on a mastermind group. And the other important thing about mentors is that you don't necessarily need to hire that mentor. You can, if you admire, let's say Tim Ferriss, you can make Tim Ferriss your mentor. He's got countless hours on podcasts. He's got all his books. He's got all these things. So study them. Jim Rohn is one of my mentors, and I never met the guy, but I have listened to literally hundreds of hours of his video seminars, and while driving my car, and I've taken notes about it. I've journaled about it. So I'm really absorbing all those things. So that's another very important thing to consider.
So we just got a comment. All the guests, Ernesto has had some of the best inputs on work, mentorships, etc. Hands down, amazing conversation so far. So kudos to you for this. It sounds like a bit of a high note to go out on.
Say that again?
Sounds like a high note to go out on. I usually aim these to be about 20-25 minutes. Sounds like we should have you back at some point. We should probably continue this conversation because I think what we discussed is exactly that, which is how do you get to that initial question of I'm ready to be someone different. Maybe the next question is a little bit of who does someone different look like and what it takes to get there. So just for everyone, again, in case we convert this into a podcast, how can people reach you?
So my website, drernestomd.com. That's where they can find the links, the blog posts, sign up for the newsletter. And I'm putting something together there at drernestomd.com/Darshan. And if you opt in there, I'm going to send you some additional resources that I think are going to go really, really well with our conversation today, and a video training that I did recently.
That's awesome. Thank you. And any parting words for the physician entrepreneurs, for the non-physician entrepreneurs who are saying, I'm sick and tired of being sick and tired, and I want something different?
Well, as Jim Rohn used to say, if you don't like where you are, move. You're not a tree. Now, the thing is, don't just jump and go somewhere. Start making moves. Don't wait for it to be completely unbearable. Start making some moves. Start looking out. And if there's somebody who's done what you want to do or what you would like to do, talk to them. It's crazy. It's crazy how people will not reach out to other people. Like, just, we have social media. That's the name of it. Social media. Just reach out. Send them a DM. Send them a message. Just follow them there. Talk to people and say, hey, how are you doing this? I'm still to find somebody that I've spoken to and said, hey, I really admire what you've been doing. How did you do this one thing? Don't say, can I pick your brains for 30 minutes? Because that's a big ask and nobody's going to say yes to that. But if somebody sends me a DM and says like, listen, I'm really interested. How did you get into coaching? I'll respond. And 99% of people that I've sent a similar message to responds. So start doing that. Start filling your mind with possibility, because that's a problem. Once we start getting really frustrated, it kind of like we shrink down and we get stuck in our little box and like, I've tried everything and nothing works and there's nothing I can do. I just need to get it. Just start feeding your mind with some possibility, and suddenly you're going to start coming up with great ideas.
Awesome. That was a perfect place to leave off. Ernesto, thank you so much for coming on. It was wonderful having you on. And I hope people consider going to the website, finding some of the different things you have available for us. And we look forward to having you back at some point.
Yeah, of course. You let me know. Had a great time.